Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is tetanus? Tetanus is a serious but preventable bacterial infection that affects the nerves. Commonly referred to as lockjaw, the disease is spread by contact with an object or surface that has been contaminated with Clostridium tetani. Transmission is most often the result of a puncture wound that provides the bacterium easy access into the body. /r/n/r/n tetanus can be prevented with a simple vaccine. However, if you have not been vaccinated and are infected, the disease can cause muscle spasms ranging from mild to life-threatening. /r/n/r/n There are currently no blood tests available to diagnose tetanus. As such, treatment would begin upon the appearance of symptoms and may include a tetanus antitoxin, intravenous antibiotics, antispasmodic drugs, and mechanical ventilation. /r/n/r/n If left untreated, a tetanus infection can progress from mild spasms to powerful whole-body contractions, suffocation, and heart attack. There is no cure for tetanus. /r/n/r/n This article discusses tetanus, symptoms of tetanus infections, treatment, and prevention. It also explores what tetanus looks like and how it feels. /r/n/r/n In addition to generalized tetanus, there are other, less common forms of the disease. /r/n/r/n Tetanus typically begins with mild spasms of the jaw muscles, referred to as trismus or lockjaw. The facial muscles may also be affected, causing tetanus to look like a spontaneous grimace or grinning expression, referred to as rhesus sardonicus. /r/n/r/n In generalized tetanus, which accounts for around 80% of all tetanus cases, the involuntary contractions will descend from the head and eventually affect the entire body. From the jaw and face, the spasms will move downward to cause neck stiffness, difficulty swallowing, and rigidity of the chest and calf muscles. /r/n/r/n As the spasms worsen, they can lead to painful contractions, known as opisthotonos, in which the entire body will literally arch with spasms from the head right down through the neck, back, buttocks, and legs. /r/n/r/n The contractions can last for minutes at a time and become so violent that they tear muscles and break bones. Other common symptoms include sweating, episodic high blood pressure, and the episodic loss of bowel and bladder control. /r/n/r/n The spasms can also close off breathing passages, resulting in the shortness of breath, choking, and periods when there is no breathing at all. The episodes are often triggered by minor stimuli, such as a sudden draft, loud noise, bright light, or even a light touch. /r/n/r/n In severe cases, sympathetic overactivity, SOA, will occur in which sympathetic nerves, which govern involuntary body responses, are hyperstimulated, triggering the spasmodic constriction of blood vessels. Symptoms of SOA include /r/n/r/n In combination with tetanus-induced spasms, SOA can trigger life-threatening complications including pulmonary embolism, blood clot in the lungs, and heart attack. Respiratory failure is the most common cause of death. /r/n/r/n Even with comprehensive treatment, 10% of tetanus infections will result in death. /r/n/r/n Clostridium tetani is an anaerobic bacterium, meaning that it cannot live or grow where oxygen is present. When exposed to air, the bacterium will form a protective spore which allows it to remain in a dormant state, largely impervious to heat, dryness, ultraviolet radiation, or household disinfectants. /r/n/r/n The spores can remain viable for years in soil and be reactivated when it is returned to a favorable moist environment. One such environment is a deep puncture wound in which the reactivated bacteria is able to establish an infection. /r/n/r/n Once in the body, tetanus will release toxins known as tetanospasmin toxins that bind to nerve cells. The toxins will then spread through peripheral nerves until they finally reach the central nervous system, the brain and spinal cord. /r/n/r/n As the bacteria multiply and amplify this effect, the tetanospasmin toxins will begin to block the production of certain chemical messengers, known as neurotransmitters, that control voluntary muscle movement. /r/n/r/n In terms of toxicity, tetanospasmin toxin is the second deadliest bacterial neurotoxin next to the botulinum toxin found in Botox. /r/n/r/n Tetanus occurs almost exclusively in people who have not been vaccinated against C. tetani. /r/n/r/n It is seen more commonly in warm, moist climates and in areas where there is a lot of manure in the soil. The disease has long been associated with puncture wounds caused by rusty nails. While the rust itself plays no role in the transmission of the disease, a common misconception it readily harbors C. tetani spores. Stepping on a nail simply delivers the spores deeper into the body, whether it is rusty or not. /r/n/r/n Tetanus is also associated with injecting heroin, usually as the result of spores found in contaminated heroin rather than on the needle itself. Animal bites can also transmit the bacterium, as can compound bone fractures, burns, and body piercings or tattoos performed with unsterile equipment. /r/n/r/n While dental procedures have also been implicated, they most commonly occur in developing countries where standard surgical hygiene practices are not in place. Medical procedures, such as surgery or injections, are unlikely routes of transmission. /r/n/r/n Today, with routine vaccination of children and adults, only around 30 cases of tetanus occur in the US each year. Worldwide, tetanus causes around 60,000 deaths annually. /r/n/r/n There are no blood tests able to diagnose tetanus. While a bacterial culture may provide evidence of infection, by extracting a fluid sample from an open wound, it has a true positive rate of only around 30%. /r/n/r/n This means that of all the people who have tetanus and are tested for it, only 30% will have a positive test that confirms infection, even though the other 70% are also infected. Because of this, tetanus will be treated presumptively based on the appearance of symptoms and your vaccination history. /r/n/r/n One in-office procedure that may support a diagnosis is the spatula test. This involves the insertion of a tongue depressor in the back of your throat. If you have been infected, you would react abnormally and reflexively bite down on the depression. If you have not been infected, the natural gag reflex would compel you to push the depressor out of your mouth. /r/n/r/n If the symptoms are inconsistent or non-specific, your healthcare provider may order tests to check for other possible causes. The differential diagnoses may include a host of other conditions, including /r/n/r/n The treatment of tetanus will vary based on your vaccination status. /r/n/r/n If you have a deep wound but have been previously vaccinated against tetanus, you may be given a drug called tetanus immunoglobulin, TIG. /r/n/r/n Also known as tetanus antitoxin, TIG is a medication made up of immune proteins, known as antibodies, that are able to neutralize the tetanospasmin toxin. TIG is delivered by an injection into the muscle of either the upper arm or thigh. Localized pain and swelling are the most common side effects. /r/n/r/n However, if you have not been vaccinated or did not complete your vaccine series, TIG may be given alongside the appropriate round of vaccinations, see below. This would need to be started as soon as possible after the injury, ideally no more than 48 hours. /r/n/r/n If you have symptoms of tetanus, you would need to be hospitalized and undergo a more aggressive course of treatment. The course of treatment would vary based on the severity of your symptoms. /r/n/r/n Mild tetanus would typically involve one of three treatments: /r/n/r/n. On the other hand, severe tetanus may involve multiple medications and mechanical interventions to prevent some of the more severe manifestations of the disease. Treatments include /r/n/r/n. To maintain nutrition, a high-calorie diet may be delivered in liquid form through either a drip in the arm, parenteral nutrition, or through a tube inserted into the stomach, percutaneous gastrostomy. /r/n/r/n. Severe cases may require 4 to 6 weeks of hospitalization before you are stable enough to be released, although it can take months to recover from some of the damage done to the central nervous system. /r/n/r/n. While most adults can achieve recovery, tetanus seizures can cause permanent brain damage in infants due to the restriction of oxygen. /r/n/r/n. Since the introduction of the tetanus vaccine in the 1940s, the rate of tetanus infections worldwide has decreased by over 95%. Today, the tetanus vaccine is combined with other vaccines able to prevent common childhood diseases. /r/n/r/n. The DTaP vaccine provides protection against 3 diseases: diphtheria, a bacterial respiratory infection, pertussis, whooping cough, and tetanus. The DTaP vaccine is given in a series of 5 shots in the upper arm or thigh at the following intervals, /r/n/r/n. It is also recommended that adolescents get a dose of the Tdap vaccine between the ages of 11 and 12. Thereafter, a TD booster shot should be given every 10 years. /r/n/r/n. In the event of suspected exposure to tetanus without symptoms, the Tdap vaccine may be given as a means to avert infection. /r/n/r/n. Known as post-exposure prophylaxis, PEP, it is indicated for people who have not been previously vaccinated for tetanus, did not complete the vaccine series, are unsure of their status, or have a dirty wound and have not received a booster shot in the last 5 years. It should be given within 48 hours of the injury, either with or without tick. /r/n/r/n. You may or may not be given the PEP vaccine under the following conditions. /r/n/r/n. If you get a cut or puncture wound, it is important to clean it immediately with hot water and soap. Take extra care to remove any dirt, foreign object, or dead tissue that may be embedded in the wound. /r/n/r/n. After cleaning the wound, apply an antibiotic cream or ointment, such as Neosporin or bacitracin, and cover the wound with a sterile bandage or gauze. Change the dressing once a day or as needed, and avoid getting the wound wet. /r/n/r/n. Even though tetanus is rare in the United States, you would still need to take the appropriate precautions if you experience any significant break in the skin to prevent tetany or any other potentially serious infection. /r/n/r/n. If you cannot clean the wound on your own, see your healthcare provider or visit the nearest urgent care clinic. If you develop any worrying symptoms, do not hesitate to call your practitioner or seek treatment as soon as possible. Bring your immunization records if you can to ensure you are given the appropriate treatment. /r/n/r/n. Tetanus symptoms typically set in somewhere between 3 and 21 days after exposure. The average time from exposure to illness is 10 days. However, symptoms can start as early as 1 day after exposure or as late as several months. /r/n/r/n. Tetanus infections do not cause a rash and the wound will not show signs of tetanus. The first symptoms can take days, weeks, or even months to appear and usually start at the jaw. /r/n/r/n. From the outside, tetanus may look like muscle tightness in the jaw, neck, and face. Tetanus infection can cause involuntary facial expressions like a grimace or a grin. /r/n/r/n. It depends. Tetanus can be transmitted through an animal bite. If you are up to date on your tetanus vaccinations, you do not need another shot. But if you haven't had a tetanus booster in the last 10 years, you may need to get another shot. Treatment with tetanus immunoglobulin, TIG, may also be prescribed. R/n/r/n if you have been vaccinated for tetanus in the past 10 years, your immune system should be able to fight off tetanus. However, if you are not up to date on your tetanus vaccinations, you will need medical treatment for tetanus. R/n/r/n babies require 3 tetanus shots before age 1, then boosters between 15 and 18 months, another between ages 4 and 6, and a final shot between 11 and 12 years old. Adults should get boosters every 10 years. R/n/r/n if you get a serious cut and are unsure when your last tetanus booster was, you may be given another tetanus shot just in case. R/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.